Well, good morning. I'm speaking here today in Red Deer on Indigenous traditional territories represented by Treaty 6 and 7 and land that has also been a historic gathering site for the Métis. I'm here today to demand answers from the UCP on how they will address the deepening crisis at the Red Deer Regional Hospital. As of 5 p.m. Friday, all general surgeries at the Red Deer Regional Hospital were diverted to other locations. Patients who were expecting necessary surgeries were told they would be taken the highway to a different community. Not only does this create anxiety and uncertainty, we never should have found ourselves here in this situation. Red Deer is Alberta's third largest city, and its hospital serves hundreds of thousands in central Alberta. The Red Deer Regional Hospital must be able to provide essential health services, including surgeries. The fact that it is not able to, it proves the complete failure of leadership from the UCP government and the two UCP MLAs, one a cabinet minister who represents this city. Just 1 week ago, 14 ambulances were forced to wait outside the emergency department because there was no capacity for additional patients inside. Instead of being cared for in the hospital, patients were forced to receive care in the parking lot. I can't imagine what the EMS crew, the patient in that 14th ambulance, must have felt. What's more, the ambulances in the parking lot were unable to be available to make other calls, causing the wait times for ambulances to get longer. The UCP's mismanagement of health has hurt healthcare across central Alberta. Hanna, Drumheller, Three Hills, Sundre, Rocky Mountain House, and Rimbey are all experiencing space and bed reductions in their hospitals. This puts even more pressure and demand on the Red Deer Regional Hospital and the folks who work inside it. So frankly, enough is enough. The UCP needs to tell us today what the plan is to restore stability in healthcare in Red Deer. All that the UCP has done is create more chaos in our public healthcare system. They've been openly hostile with doctors, nurses, and health professionals, driving many out of the province. This has had a direct result on the worsening care Albertans are receiving. We have yet to receive any answers or information from the UCP on how the challenges of central Alberta and Red Deer will be addressed. Unfortunately, it seems the UCP are more concerned about their internal conflicts than with providing Albertans with the care they deserve. Here in central Alberta, the UCP MLAs are obsessed with their internal leadership drama or fending off nomination challenges. The only times that Jason Kenney stops by Red Deer now is if it's a stop for his leadership vote. No one in the UCP is focused on patients and families or healthcare workers. The Premier is out touring the province to save his job, but he's not talking to burned-out healthcare workers who've been pushed to the brink by his government and are wondering if they can even carry on with their jobs. He's not talking to doctors who continue to feel disrespected and dismissed by his government. He's not talking to people in communities about how their hospital is being forced to close beds and they can't find a family doctor. It seems you have to be a UCP member eligible to vote in support of the Premier's leadership to be worth his time. Otherwise, you're not. The people of Red Deer deserve so much better than this. They deserve better local representation, MLAs who will actually advocate for better health care and hold their own party and government to account for the unacceptable situation we have here now. I've yet to hear Adriana LaGrange or Jason Steffen step up and demand better health care here in Red Deer. They should be the ones outside the hospital here today. It's just another reason why Albertans cannot trust the UCP. The people of central Alberta deserve a better government, one that will strengthen public health care, not tear it down and continue to throw it into chaos. So to all the patients who are waiting for surgeries, Albertans who are worried about ambulance response times, and residents in communities like Red Deer and across central Alberta who cannot access their emergency department or find a family doctor, please know that Alberta's NDP will not let the UCP off the hook for the harm they have caused, the damage they have done. We will continue to call on this UCP government to act, but I promise you, an Alberta NDP government will act. Thank you, and I'm happy to take questions.
You're on the Zoom or the please use the raise hand function or *9 if you'd like to ask a question. But we will start here on location to see if there's any questions.
Hi, my name is Alessia and I'm from RD News Now. Sorry about that. Thank you. I would just like to know, we spoke to some doctors earlier last week, and they said that this problem was there before the pandemic, and that this hospital has needed an expansion for a while. So in this case, what would the NDP do specifically? What do you think, firstly, is the root cause of the problem? And secondly, what actions would your government take to resolve these issues?
So you're right. There have been issues that I think within healthcare in rural areas and certainly in central Alberta for some time. Certainly there have been increasing pressures at the Red Deer Regional Hospital. Certainly that's why we, in our term as government, did step up and provide funding to begin working on the business plan for the expansion here at the hospital. And certainly the government is committed that they're going to follow through on that construction. But the thing is, we are here today. The root cause of this issue is the repeated decisions of this government during a global pandemic to act last and act least. They pushed our healthcare system to the brink and all of the workers that make it possible, utterly exhausted them. They did this while attacking and going to war with doctors and physicians in the province of Alberta, driving many away, deepening the pressure and the crisis here at the Red Deer Regional Hospital. So yes, some of the problems were pre-existing, but this government has made every single one of them worse. So in terms of what we would do, well, there's not an immediate solution. Unfortunately, the position that the government has put us in is a very difficult one. But certainly what we need to be doing, first of all, is looking after the healthcare workers that we have. So ensuring that they have mental health supports and other things to help address the pressures they face and help them be able to continue to work. Secondly, we need to see the government down tools on its war with doctors and physicians. We need to have a fair contract available here, like is available in every province in Canada. It's an incredibly competitive field out there for healthcare workers right now. And the reputation this government has created for healthcare workers in the province of Alberta is making it very, very difficult for us to recruit. So we need to see a fair deal. We need to see the government begin to collaborate with and support healthcare workers instead of driving them away. And lastly, indeed, we do need to make those investments. So certainly what I'm hearing from folks in Red Deer, from the doctors, physicians, municipal leaders, is they want to see a lot more specifics on the UCP's plan for the Red Deer Hospital. So they've promised dollars, they've made some big commitments, but of course they did that a couple years ago and then stalled. So folks really want to see some details on the plan to make sure that we are going to have the investments in place to get the expansion here going as quickly as possible.
How would you attract doctors to come into the more rural areas of central Alberta? So even beyond Red Deer, the surrounding areas, how would you attract healthcare workers there?
So certainly there's a number of steps that can be taken, and certainly, you know, our rural municipal leaders and community leaders have been very active on that for some time. And what we do know is, first of all, having a fair contract in place and fair support and having that certainty, that is a big part of it. Secondly, working with our communities to help them build them as more attractive. Certainly having well-funded healthcare services, not having a government that's attacking matters, but certainly they're also looking at our education system. They're looking at how our government supports a lot of our other public services. Thirdly, giving, I think, medical residents the opportunity to get experience in rural areas. Now, unfortunately, we have seen recently with the most recent match, Alberta had a number of slots, particularly in family medicine, that went unfilled. It's unprecedented in Alberta history, and again, it's because of the antagonistic relationship this government has created. So we have to change how we are relating with them, but also give that opportunity, particularly for post-secondary students. I've talked with the College of Physicians and Surgeons of Alberta and some others, and what they've said is when students get a chance to practice in a rural setting during their education, they are more likely to return to work in a rural setting. And if we recruit students from rural settings, they are more likely to return to their communities as well. So there really has to be a mid and long-term focus on providing the opportunities for them to get experience in rural areas and also to recruit students from rural areas. And again, I know I keep harping on this, but this government's attack on physicians did a lot of damage to some of the most respected rural practices in Canada for training rural doctors, and caused a lot of disorder and disruption, and that was even before the pandemic. So really, it really does matter the attitude that the government brings to the table and how they work with and collaborate with healthcare professionals.
Susan Zelensky with the Red Deer Advocate. This is the third time since, I think, mid-December that surgery has been diverted. Why do you think that keeps happening in Red Deer? Because there are other rural hospitals that are probably in the same position.
So the opportunities I've had to speak with surgeons here at the Red Deer Regional Hospital and others, it is in part a challenge with personnel, with having the actual healthcare workers. They have lost a number of anesthesiologists. They have lost a number of hospitalists. They've lost nurses. So there just simply is not the capacity of individuals to always be able to keep up with the surgeries that need to happen. So that's one of the problems. Secondly, has just been the repeated pressure of the pandemic. So again, Red Deer Regional Hospital is a central hub for many surrounding communities. So certainly during the fourth wave and into the fifth, we saw the pressure from folks coming in from those communities who had COVID-19, who needed beds. That pressure landed on the RDRH. And so then unfortunately that means those resources are not available to continue to provide surgeries. So a lot of it has been just the chaos and disruption that's been continually caused by the UCP government through their attacks on doctors and healthcare workers and their mismanagement of the pandemic.
One other thing Red Deer and Central Albertans have been waiting for is the expansion of the hospital, and they want to see plans. They've been hearing about the expansion for years. They want more concrete information, physical plan on what's going to be happening. Do you think that's out of line to ask the Conservative government or UCP government right now that this is what they want?
Not at all. I think that's a perfectly prudent ask. And again, I've heard that from municipal leaders, from some of the folks that work here at this hospital. They want to see specific plans. And, it was no coincidence that the announcement of the funding and everything came just as Jason Kenney was moving into his leadership review and trying to save his political life. So I think folks have a right to be a little bit skeptical about the timing of that. The fact that this government did delay for, I think, an extended period from when they promised funding would be. They said actually shovels would be in the ground last year. So I think it's perfectly reasonable that people want to hold the government to account, that they want to see specific plans and timelines for the work that this government is promising to do. Because as we can see, with the continuing crisis here, this is not something that we can afford to stall on any longer. This work needs to get underway.
All right, we will now go to the phones and Zoom. If you have a question, please use the raise hand function or *9. Dean Bennett, your line should be open.
You said off the top you're looking for answers on this. Well, it looks like, they've got the answer for the general surgeries. They just don't have the clinical. I think that's like something that can be solved overnight. How are they going to be able to solve that in the short term?
I'm sorry, Dean, I lost part of your question there. Could you just repeat that again?
Yeah, they're saying that the reason for the surgery cancellation is they don't have the. How fast can you do that? That seems to me like more of a longer-term problem, isn't it?
So again, Dean, I'm sorry, it's breaking up a bit. Were you talking about the shortage of healthcare workers or a shortage of capacity in terms of the physical space?
Clinical assistance. And that's why surgeries are being canceled. How fast do you think they can solve that?
Okay, so what I think I heard you say, you were sort of talking about clinical assistants and other folks that are involved in getting the surgeries done? Okay. Yeah, and you're right, Dean. To some extent, there are real challenges in how quickly we can ramp that up. This government has exhausted the current healthcare workforce. They've created an atmosphere that is very unattractive for us to recruit more. And indeed, we know there is a squeeze in many jurisdictions across Canada. So there is a real challenge in meeting that need. But certainly what we need to see from this government is a plan on actually how they intend to address that. So certainly there is work that needs to be done within the post-secondary system for us to be able to train more Albertans to be able to move into these positions and these roles. We need to be looking at, do we need to offer more opportunities to upskill folks perhaps from LPN to RN or from or to be able to take on additional work in the system or additional training to be able to work in an OR or an emergency room or an ICU. And of course, then there has to be active recruitment. So all provinces are doing that. There are opportunities, of course, for healthcare professionals, even from outside of Canada. But that's going to take some concerted work on the part of the government, and we need to see a plan and a strategy to get that done.
Do you have a follow-up, Dean?
how do they regain trust with doctors? They've been working with them for a year now. How do they regain that trust? Is it repealing parts of Bill 21?
So absolutely, certainly repealing the parts of Bill 21 that allow this government to simply tear up the agreement with doctors on a whim, for the healthcare minister the health minister to basically be able to impose, decisions without any discussion, as we saw happen so often under Minister Shandro. Certainly those are big parts of it. Doctors are looking for certainty if they're going to come and set up shop here in the province of Alberta. But secondly, the government needs to be honest with Albertans. I have doctors in various hospitals and various settings who are texting me and telling me the incredible pressure they are under, the crisis that is building in our healthcare system. And the minister stands daily in question period at the COVID updates and generally dismisses it. Well, we're a little bit over capacity in here and there, but overall everything is fine. So that is frankly gaslighting. And that is hurting the morale of doctors, physicians, nurses, other healthcare workers across the province of Alberta. And particularly when they see this government at the same time is driving hard on its plan for privatization, squeezing more private profit out of many areas of our public healthcare system. They see a government that does not seem to have its eye on the ball, is not hearing what they're saying, and is not prioritizing what's important for them and for Albertans. So certainly doctors, if we want to get more to the province of Alberta, they have to see they have a government that's actually invested in supporting and stabilizing our public healthcare system.
Do you have another question, Dean?
Bye. Thanks.
All right, we'll make another pass for questions. If you have questions on the phone or the Zoom, please use *9 or the raise hand function. And seeing no other questions, that will conclude our press conference today. Thank you, everyone.
Thank you.
Much for watching, and to learn more, check out albertasfuture.ca.